So, Dr. Dobak, something that catches some mothers off guard is having a pregnancy that is deemed high risk. I had a high risk because I was over 35 with both of mine. Can you talk about what that means and what does it mean for a pregnancy to be high risk and what causes it?
Great questions, and I think a lot of us feel a sense of guilt if you get deemed high risk, but it's more a teamwork approach is what we're at least trying at TMH. Is we know per the CDC and the World Health Organization that we have seen a significant increase in pregnancy complications. So we're trying to see what we can do to help get better outcomes and bring those complication rates down. And so there are a number of different reasons you could end up seeing a high-risk specialist. And one of the more common ones is just preterm labor, just going into labor early or starting to contract early. Not an unusual thing to happen where you might spend a night or two in the hospital while we try to get the contractions to slow and maybe get some steroids on board. Many of us might have some underlying medical conditions that can sometimes add risk to the pregnancy. Hypertension is probably one of the ones we're seeing more of, but diabetes as well, lupus, thyroid conditions, all those underlying medical problems can add some risk. In another area, sometimes we'll notice things with the baby. Sometimes the babies aren't growing as well as we'd like. Sometimes we'll find some abnormalities that may just be minor, that just need some follow-up after babies are born, which wouldn't change where you deliver or how you deliver or when you deliver, but just things we want the pediatrician to keep an eye on. And of course, then there are those conditions where sometimes we'll need to send patients either to Wolfson's or Shands just to have some other specialists see them because they might need some things done immediately after delivery. And so a lot of it is we're just trying to be more of a team, especially here at TMH, and we have amazing midwives and OBs here in town, and so we just try to help them and answer questions and sometimes follow your baby a little bit closer if there's anything we're seeing where we're not on a standard growth curve.
Okay. So you may have kind of answered this already, but once a woman knows her pregnancy is high risk, where does she go from there?
Sometimes it's not known until you're in labor and delivery with the contractions or if there are any issues with, the bag of water breaking early. So if you're in the hospital, of course, then we'll oftentimes be involved and either help take care of you while you're in there or set up outpatient visits with your midwives or OBs in our office. Sometimes we'll know before the pregnancy. We do a fair number of preconception consultations so we can have conversations with moms and or couples to kind of talk about what to expect and what sorts of risk might be involved with their pregnancy, what that might mean to any future children and to their future health. And sometimes it'll be something seen early on in the pregnancy where the midwife or the OBGYN will either find something on blood work or something on ultrasound, and then they'll refer to us.
Okay. Does having a high-risk pregnancy automatically mean that your child will have high-risk conditions? Does the risk end when the baby's born?
The good news is many times the baby will be fine. Our goal is still a full-term healthy vaginal delivery in most cases. That's still our goal, and all the providers in town I know strive to get that. High-risk conditions sometimes might mean we deliver a little bit earlier, sometimes 2 weeks, sometimes a little bit earlier than that. And of course, there are some conditions where we have to deliver much earlier, and prematurity might have some effects on the baby, so there is an overlap there. And then there are those situations where that pregnancy is deemed high risk only because of things we find on ultrasound. And then of course, that has a much bigger effect on baby than any maternal condition might.
All right. With all these things that we can't control, there are also some we can. So how can moms set themselves up for the healthiest pregnancies and childbirths possible?
We encourage everyone to be as healthy as you can prior to conception. Certainly, we want everyone taking a prenatal vitamin prior to conception. We think there's definitely been shown value for the baby with the extra folic acid and the additional vitamins. and myself included, are guilty of maybe not being physically active enough. And so we also encourage physical activity. I think exercise in pregnancy has definitely been shown to be safe. American College of OBGYN strongly encourages that as well.